Gita and Team NOGS for giving me this opportunity to present this topic. Thank you, Dr. Varsha. And also thanks to the Dr. Sindhu Bhute, Dr. Rekha Bivpurkar and Dr. Bharat Lanjewar for giving me this opportunity. Osteoporosis, we are all practicing infertility, obstetric, gynec, laparoscopy, but no one is look after osteoporosis. लहानपणी लहान मुली असतात त्या सगळ्यांना आवडतात. वेगवेगळ्या प्रकारचे ड्रेसेस त्यांना घालता येतात, सगळं घालता येतं त्यांना, दागिने घालता येतात, टोप्या घालता येतात. मुलांना त्या मानाने कमी असतात. ती गोष्ट आपण काही डिस्कस करू नये. मुलगी मोठी होते, ती सगळ्यांना आवडते, थोडीशी कामाला मदत करते. त्याच्यानंतर कॉलेजलाही जाते, प्रियकरालाही आवडते, मुलांनाही आवडतात. लग्न होतं, नवऱ्याला आवडते, जेवण करते, मुलांना आवडते कारण आई काम करते. आणि एक स्टेज येते 45 नंतर मेनोपॉज. सगळेजण इंडिपेंडेंट झाले असतात, सासू सासरे सुद्धा, मुलं सुद्धा, नवरा सुद्धा, and then no one is looking after her. This is the tragedy, and that's why I choose this topic of osteoporosis. Because postmenopausal osteoporosis is very common. 1 in every 3 women facing this problem. And I am actively practicing osteoporosis in my clinic with my DEXA machine also. So now, to see osteoporosis, these are the clinical manifestations. There is no clinical manifestation unless there is a fracture or any symptom. Fractures of hip and spine occur in absence of major trauma. These are the features: kyphosis, loss of height, active and passive range of motion, pain and pain-free. Neurological examination is essential to rule out spinal cord and peripheral nerve compromises. Otherwise, without fracture, still we are not diagnosing this. That means our ladies are suffering from this and we are neglecting them. After menopause, it's a sad story. Patient comes with the complaints of mood swings and all those. And our members, they are referring to psychiatry. And they comes to you with back pains, joint pains, and they are referring to orthopedician. I think this is the sad part of us. We should look on this. See, diagnosis is important, screening is important. The diagnosis of osteoporosis relied on quantitative assessment of bone mineral density, which is currently considered the best practice of osteoporosis fractures. BMD is very important. As you know, BMD, I don't want to highlight it. These are the common fracture sites. Femur neck BMD can predict hip fracture, and lumbar spine BMD can predict vertebral fractures. T-score and Z-scores are very important in diagnosis. As all knows, T-score is very important. Z-score is related to that. Main thing is, T-score is calculated by taking the difference between a patient-measured BMD and the mean BMD in healthy young adults, matched for gender and ethnic groups, and expressing the difference relative to the young adult population standard deviation. And this is Z-score. These are the groups we are targeting for testing, but this is wrong. See, these are the groups, but all women over the age of 65, this is American standard, but in India, females or women, they affect after 40 years also. And in this, after post-COVID pandemic, it has to observe that those who are having history of COVID, even young females also, they are having osteoporosis, chances of osteoporosis. All you know the risk factors, and that I don't want to highlight it. The BMD measurement is very important. These are the two common methods: dual energy X-ray absorptiometry, DEXA scan, and quantitative ultrasonography. These two are important, and we are following that. All you know, DEXA scan we are doing. This is a DEXA, and this is a still gold standard. All other investigations are there, but I think practically it's not feasible to carry out in our clinic. This is DEXA machine. All three parameters are important. Many times People, they are referring to other centers, they are only doing spines. No. WHO standard and Indian International Osteoporotic Foundation, they told spine, hip, and radius ulna. These three contributes to the osteoporosis measurement, screening and measurement. DEXA, it requires well-trained personnel, correct patient positioning. But remember, many people, they are not taking because no, it requires software, personal. It's not like that. In my clinic, my DEXA machine, our staff is doing all DEXA and that only 10th pass. They don't know computer also, but they know all the details of all these, how to save the data, how to print out all those. So it's not like that. You should train your personals. See, this is DEXA of femur, DEXA of spine, DEXA of arm, unused arm should be used. And this is reporting. How it is reported? Normal bone density, osteopenia, and osteoporosis. As all you know, normal means minus 1.0 and above, and T-score between -1 to -1, 2.5, minus 2.5 is osteopenia, and below minus 2.5 is osteoporosis. And severe osteoporosis is minus 2.5 and below with fractures. What are the advantages of DEXA scan? The most accurate and precise method available for the diagnosis of osteoporosis. It is one of the best methods to estimate fracture risk. Non-invasive, rapid, safe, and very low radiation dose. And this is common, we are all using qualitative ultrasound. Broadband ultrasound attenuation is the calcaneus of the dominant foot as a potential indicator of hip fracture risk. We are all using in these camps and all. This is having also advantages. It is radiation free, cheap, easy to use, portable, and it has the possibility of predicting fracture risk. It's portable, you can carry it anywhere easily, hardly 10 kg weight, not more than 10 kg. Some disadvantages are also there, difference of BMD between right and left feet, individuals with intellectual disabilities, validity and sensitivity has not been established for the kinds of populations not validated as a screening method for osteoporosis. But it definitely, it will smell something is wrong and you can refer it to the DEXA center. This is very important. No doubt other disadvantages are there, but each and every clinic, I will appeal, at least you should do osteoporosis screening with this machine. There are recent advantages also in this, both lumbar spine and femoral neck. This is conventional radiography, but in radiography, only 30% accuracy is there. Lesions less than 2 centimeters may escape detection. See, in this case, radiographic manifestations of osteoporosis, it's increased radiolucency of bones and decreased number and increased thickness of trabeculae. See, cortical thinning is there. See, these are the radiograph of femur. It reveals trabecular bars. See, these are the bone bars perpendicular to the long axis of bone. See in face of the frontal view. See, this is very serious. It's a Dowager hump due to osteoporosis. See, note the overall reduction in the bone density and moderate kyphosis of the dorsal spine. Vertebral imaging is indicated to rule out asymptomatic vertebral fractures. See, these are the vertebral fractures, compression deformities associated with protrusion of intervertebral disc and prominence of the end plates. We are referring and people are operating on that, but no one is treating osteoporosis. See, this is grading of vertebral fractures. We don't want to go in details. See, this is vase-shaped fracture. See, this is all fracture types. This is single X-ray absorptiometry. we can do as a screening tool. Qualitative computerized tomography, we can do BMD with this also, but there are disadvantages also. This is single photon absorptiometry, but it examines BMD of the radius and calcaneus also. This is dual photon absorptiometry. Now, then what to do? Only DEXA and qualitative ultrasound. These two are important for obstetrician and gynecologist. Now come to biochemical investigations in osteoporosis. These studies, they doesn't diagnose osteoporosis, but they are used to establish baseline condition before starting treatment. That is very important. And also to exclude secondary causes of osteoporosis. These are the biochemical investigations in osteoporosis. I don't want to go in detail, but see, these are the basic investigations you should do when you will be suspecting osteoporosis or even osteopenia. All investigations, these are the basic investigations. And this is very important. These are the bone turnover markers. Treatment depends on the markers. See, two types of markers are there: bone formation markers, bone resorption markers. Why this is important? After setting up osteoporosis, our people, they are giving only calcium. नहीं, 3-4 महीने calcium घ्या, 6 महीने घ्या, होऊन जाईल. After setting up osteoporosis, it doesn't work at all only. There is no use unless and until you treat the cause. You treat the formation markers, you treat the resorption markers. Then these are the formation markers: serum total alkaline phosphate, serum bone specific alkaline phosphate, serum osteocalcin, serum C-terminal, N-terminal, C1NP or P1NP. And these are the resorption markers: urinary hydroxyproline, PYD, DPD, NTX, CTX, BSP, data resistant. What are the formation and resorption? See, simple you see, bone formation. For bone formation, if they will be in need and if that is reduced, osteoporosis there, then you have to give bone formation. Bone resorption. One patient asked me, sir, what is this medicine given? Then I told him, गळती थांबवण्यासाठीचं औषध. म्हटलं टाकी गळती आहे, आपण पाणीच भरतोय, पाणी खूप असतं. पण पाणी ज्यावेळी टंचाई येते उन्हाळ्यामध्ये, मग आपण काय करतो? कुठे कुठे गळती ते सील करतो. This is resorption. You have to stop the process. These are the indications for biochemical markers. Predict extent of fracture risk reduction when repeated after 3 to 6 months of treatment. Predict magnitude of BMD increases with FDA approved therapies. Predict rapidity of bone loss. Help determine adequacy of patient compliance and persistence with osteoporotic therapy. Then how to monitor? These are the monitoring parameters. Before initiation of therapy, monitoring the response to therapy after 3 to 6 months. Before also, these parameters you should do: CTX and P1NP. And even 3 months, after 3 months also, you should repeat. You can get very well idea. That's why these markers are very important. Now, come to management. How to manage? Treatment aims to slow or prevent the development of osteoporosis. Very important. Maintain healthy bone mineral density and bone mass, prevent fractures, reduce pain, maximize the person's ability to continue with their day life. And this is done through preventive lifestyle measure and use of supplements and sub-drugs. Preventive is also included in the management. Prevention is always better than cure. Now we will discuss the drug therapy. Drugs that can help prevent and treat osteoporosis, there are include bisphosphonates, alendronate, bizandronate, ibandronic acid, zolandronic acid, estrogen agonist. These are the SERMs, and they can reduce the risk of spine fractures in women after menopause. Calcitonin, it helps prevent spinal fracture in postmenopausal women, and it can help manage pain if a fracture occurs. Parathyroid hormone, that is teriparatide, This is approved for people with a high risk of fracture as it simulates bone formation. Rank ligand inhibitors such as denosumab, this is an immune therapy and a new type of osteoporosis treatment. And there are other many drugs are there in the market nowadays and they are under trial. Fantastic drug. No doubt they are quite costly, but cost will reduce after the use. Other types of estrogen and hormonal therapy may help. These are the recent advances, kyphoplasty and vertebroplasty. Vertebroplasty means percutaneous injection of bone cement in cancellous bone, and kyphoplasty utilizes an inflatable balloon to create a cavity for the cementing. In short, cementing should be done. See, this is a balloon. See, this is cementing will be done. This is vertebroplasty. See, this is vertebroplasty. These are the recent advances nowadays. Now we will go case by case discussion because all are telling you how to write prescription in different cases. In short, see, this is first case, 40 years old female in perimenopausal stage, complaint of severe backache, joint pain since 6 months. T-score minus 0.9, T-score of right femur minus 0.8, of left femur minus 0.7, and T-score of radius ulna is minus 1.2. What to do? She is a case of osteopenia. And now the International Osteoporotic Foundation tell any parameter, so it's all osteopenia only. Previously, no, only one parameter they used to do spine. No, this is osteopenia. History of her mother's menopause at 43 years of age. Her BMI was 16, very low BMI. Now, chances of osteoporosis are very much imminent in this case. These are the biochemical markers. Serum calcium is 8.6, means it's not reduced, but way to reduce. And serum vitamin D is 25 nanogram. Above 30 is sufficient. So it's also reduced. All other investigations were known. How will you manage in this case? See, this is prescription. You can give this type of prescription in this. Tablet alendronate or tablet imidonic acid per week. You can give severity for 3 months, 6 months, or even 1 year also. Tablet calcium per day, vitamin D per week for 12 weeks, or even more also if you need. And injection nandrolone decanoate, it's an anabolic steroid. As her BMI is very low. You can give twice or thrice. Don't give more because it has disadvantages also. Yoga, exercises, and diet protocols, they are very important. See this case, female age of 61, total abdominal hysterectomy with bilateral salpingo-oophorectomy done 10 years back. Weight 65 kg, other reports are normal. All reports are normal, but hysterectomy has been done. See this DEXA report, very serious, minus 3.5, minus 3.8, this also minus. She is having risk of osteoporotic fracture. How will you manage this case? See, I will be giving injection zoledronic acid. It's a 100 ml solution per year for 3 years. You can tell them. Screening is important, BMD is important. If you tell them, तुला 3 वर्ष तुम्हाला ट्रीटमेंट घ्यायची आहे, they won't listen. नाही का, डॉक्टर लिहून देतात आपले फार्मा कंपनीसाठी. But if you will show them result, this is for 3 years. Calcium you can give, diet, exercise, and tell them to follow up after 1 year. Every year for 3 times you should do BMD. This case 3 is 67 years old lady. History of COVID-19, given remdesivir plus steroids. Serum calcium 7.7, 7.5. Normal range is 8.6. It's very low. See, this level is low. Even 0.1 calcium, it needs minimum 1 month to 2 months to heal. And serum vitamin D, 12 nanogram. It's very less. How will you manage? And these are the reports. See, minus 3.5, minus 2.6, minus 2.5, minus 2.5, minus 3.5. High risk. It is high risk for osteoporotic fractures. How will you manage? I will suggest to give zolandanic acid per year for 3 years, vitamin D injections per month for 3 months. You can give more also. Then calcium tablets with vitamin D, diet, exercise and yoga. And every year you should call them for visit and do BMD. This case, a 45 years lady, serum calcium 7.9. See, calcium has been depleted. Normal level is 8.6. Serum osteocalcin is 0.1. Normal level is 0.7 to 6.5. Osteocalcin is formation marker. Remember, they were all were roaming. Patient comes to me. I thought, hey, it's costly. I told them, say, I will give you concession in my, but please do investigation. That is important. See her DEXA report. They are going to deplete, and one report is minus 1.4. Now we can arrest this process at this level only. How to manage this case? We have started alendronate. We can start alendronate, ibandronic acid, calciums, the tablets of calcium, calcitrol, magnesium, zinc with vitamin K27. In this osteocalcin, vitamin K2 role is very important. This is diet. This diet is full of vitamin K2 source. These are the non-veg source. This is veg source. This is very important. But vitamin K2 role, if we will forget, again she will prone for osteoporosis. Vitamin K is necessary to activate osteocalcin in the body. A lack of vitamin K results in lack of osteocalcin protein in the bones. Vitamin K deficiency is also associated with low mineral density and increased risk of fractures. So vitamin K is very important. See, this is the last case. Okay. This is 70 years old lady with complaint of severe bone pains, backache, loss of sleep due to body pain all over. Weight loss of 5 kg in 2 years. Loss of muscle mass in 2 years. Mild thoracic kyphosis present. Loss of height by 1.5 centimeters. See, because she had written her height, weight, and she was rejected. Your height, her texture was different. She was cachexic. She is a poor vegetarian, good activity in day-to-day life. All other related investigations were normal. All investigations. See her DEXA report. You will surprise with a good family. Her husband was a manager in a bank, but from a vegetarian. They are pure vegetarian. See, minus 4.7, minus 4, minus 3. High risk of osteoporosis. She was frightened to go to temples, frightened to go to marriages. This was her condition. How will you manage this case? This is very important in this. I tried this. Zolandanic acid per year for 3 years. Injection denosone of 120 milligram per 6 months I had given. For 3 years, vitamin D3 injection per month for 3 months. Injection nandrolone, decanoate per month for 3 months. Calcium, diet, exercise, yoga started after 3 months of medicinal treatment. Don't advise them, this patient, immediate yoga and immediate exercise because their bones are brittle. If they will start, chances of osteoporotic fractures are more. Tell them, तुमचं चांगलं झाल्यानंतर 3-4 महिन्यांनी तुम्ही सुरू करा. That is very important. Now, yoga and exercise, very important. Why this is management? See, they are the prevention. It includes in prevention, but you can include in as a management also. After that, tell them, these are the yoga. I don't want to go in detail. All you know, These are the yoga postures, Naukasan, Bhujangasan, Surya Namaskar. Now exercises. See, these are the exercises we can advise them. आपण स्ट्रेटली सांगतो नाही तुम्ही काय करा जिम लावा. Each and every female they cannot go to gym. Not afford. It's not a question of afford also. But many problems are there. See, you can advise them. At their home only they can do it. Skipping. See, floor push-ups you can do anywhere. Sit-ups anywhere. Abs workout anywhere you can do. No need to go to gym. Incline push-ups. See, hip raise. You can do on yourself. Side planks. Cycle abs. See, there is no need. Step-ups. आपला जिना जरी चढायला सांगितलं मी त्यांना सांगतो तुमचा जिना आहे तो चढ उतर करा. It's a best exercise for osteoporosis prevention also and management also. See, this is real enthusiasm. When I had visited Rohtang Pass, China border, and these three ladies, see, they were all above 65 and 70. And see, they are enjoying. They are taking care of. Thank you so much. Thank you.